Zanis Copperbelt Province brings to you The Lens, a program designed to bring insightful information on economics, mining, education, health, tourism, agriculture, environmental issues, sports, entertainment, current affairs, and many issues affecting the well-being of society. Welcome to The Lens, your program coming from Zanis Copperbelt Studios, and I'm your host, Tovini Ngombe. On today's program, we shall be looking at the National Health Research and Training Institute, formerly known as the Tropical Diseases Research Center. And on today's program, I'm featuring the Director General, Dr. Gershom Chongwe. Welcome to the program, sir.
Thank you.
All right, to begin our program, when was the institution established and what led to its establishment?
Okay, thank you. Thank you for inviting us. So this institution was established in 1975 in a partnership between the World Health Organization and the government of the Republic of Zambia, following the need for countries in the south of the global south, to provide evidence for combating tropical diseases, which were a very, very serious, which was causing a very serious burden on the health of the population at the time. So this institution was established and has been based in Ndola since then. So we've clocked 50, we are clocking 50 years this year since it was established.
All right, and what's the mandate of the institution?
Yeah, so the mandate has always been to provide evidence for policy making through health research. So as the name suggests, we were created to conduct research in tropical diseases, so that we could provide answers to what the government needed to do in order to combat those diseases at the time. So that has always been the mandate, and also serve as a platform for research and training in how to conduct research.
All right, and how relevant is your institution in today's environment?
Yeah, so our institution is extremely relevant because we cannot run the health sector or the health system without well-researched, well-evidenced policies. So whatever policy we come across, we come up with as government, we need evidence, we need research that points us to the right decision. So our institution is extremely relevant in that sense.
All right, and the Ministry of Health, the vision is that a nation of health and productive people. That's the vision of the Ministry of Health. And how does your institution feed into this national health vision?
Yeah, so we need healthy citizens, as I have, as a policy, as a vision of the ministry is, for the ministry to have healthy citizens, we need to provide the ministry, our role is very supportive, as to provide the ministry whenever they want, for example, drugs that can combat one of the diseases that we have, for example, malaria. Our role is to provide the ministry with information on which are the drugs to use that will help to reduce the burden of malaria. But the burden on that the country faces in terms of health is huge, and there are many, many different health problems. So we see ourselves as an institution that is there to help the ministry come up with solutions on the different health problems that we face in the country, provide research evidence that will go into policy making.
All right. And what has been your major contribution as an institution to the health sector?
Well, we know we've been existing for 5 decades, and so our contributions have been many, many, and from a wide range of subjects. So the commonest example that we can give is that we've been involved in malaria research for the whole of our existence. And in that period, we have worked on many, many different drugs, for example, come up with drugs that we've recommended for use by the National Malaria Control Program. Our work informed the change of drugs from one drug to the other. Some years back, we worked on some of our research directly led to the adoption of, for example, Coartem in the country as a drug of choice for malaria. Why? Because we noticed that the drug that was in use at a time was failing to protect our citizens. So upon our recommendations and working with various other partners within the ministry, we recommended the change of drugs. And that's just one small example of some of our achievements. Our achievements range in malaria control, TB control, nutritional diseases, HIV. We have been a focal point for some of the major research activities that have taken place in Zambia. In HIV, for example, prevalence studies and other areas that has directly led to changes in policy, changes in guidelines, and changes in the message that we send to the population out there. So we have directly had an impact on what the ministry communicates out there to the population.
All right. Actually, I remember when you said when you recommended the use of Coartem, I remember that the drug for malaria is chloroquine. When you drink it, nowadays, when you drink it, afterwards you start itching.
Yeah. Yeah, at that time that was the drug of choice, and unfortunately it was failing. And so the work we did, our men and women, the scientists at TDRC, directly led to the ministry making a decision to change from chloroquine to Coartem, and many other similar achievements. So it's not just the drugs that we use for treatment. There are even drugs that we've done research on that are currently in use for prevention, for example, and also drugs and chemicals that we use for example, spraying in the homes. The research that goes into that is done by our scientists at TDRC. They go out there, they test the drugs, and then once we know that this drug is going to work, that's what we recommend, and the Ministry of Health adopts those drugs for use. Yeah.
All right. Recently, your institution also changed the name from the Tropical Diseases Research Center to the National Health Research and Training Institute. What caused the change?
Yeah, so as you can just see from the name Tropical Diseases Research Center. So that name was sort of giving a perception that we only conduct research in the tropical diseases. And these diseases, tropical diseases, are diseases that you find around the tropics and the subtropics, including malaria, not HIV, malaria, sleeping sickness, bilharzia, those kinds of diseases, leishmaniasis. So that was what informed the creation of the institution, those kinds of diseases that are found in the tropics. But the burden of diseases has expanded, and it has gone beyond those tropical diseases to include other diseases, including not only those that I mentioned. They are still a problem, but we have HIV, we have TB, we have non-communicable diseases that are not restricted to the tropics. So the ministry felt that our name needed to reflect that work that we do. The work that we do is beyond just tropical diseases. We actually do research in non-communicable diseases, cancer. We do research in HIV, TB. So it was decided to change the name to reflect what we do. And so basically the name also means that we are going to have a broadened mandate to include other diseases and other programs. And if you look at the other part of the name also, we have a training. So National Health Research, which broadens our mandate, and Training Institute. So we will also be involved in training not only health workers, but people out there that may be interested in some of the things we do, research programs, scientific writing, and other similar things that we will be doing to capacity build the population out there. So we have a broader mandate, and that mandate includes, apart from doing research in these imaging and re-imaging infectious diseases, we will be doing research and capacity building, and also research in traditional, complementary, and alternative medicines. So the expansion of the mandate also includes that.
All right. Well, viewers, if you have just joined us, you are watching The Lens, your program coming from Copperbelt Zanis Studios. And on today's program, we are looking at the National Health Research and Training Institute, which was formerly known as the Tropical Diseases Research Center. And in the studio, I have Dr. Gershom Chongwe, who is the Director General. To continue our program, Doc, let's look at what are some of the diseases of public health importance?
Okay, so the diseases, when we say our mandate is to conduct research in diseases that are important to public health, we mean all the diseases that afflict our population. So our mandate is broad. So we can conduct research in pretty much any disease out there, but those diseases that are important to the public. So it means that whatever afflicts the public, whatever is bothering the people of Zambia, be it HIV, be it TB, malaria, cancers, we are there to conduct research on them, on those diseases, so that we can meet the mandate, which is to provide evidence of when the government is coming up with policies. Those policies are informed by well-researched evidence that supports whatever decision they are going to come up with.
All right. Yeah, you talked of HIV, TB, and what could be the other diseases? Maybe public may want to know the types of diseases that are of public importance, which you deal with as well.
Okay, maybe
Yes.
we can broadly classify diseases in terms of those that are infectious, and those that are infectious or contagious. That means those diseases that will move from one person to the next person. So if I'm infected with a disease, then that disease can be transmitted to another person. That's one category of diseases. Then you can also classify diseases as non-communicable, which are diseases that are not transmitted from one person to the other. You will have them because of maybe the way you were born, or maybe because of your lifestyle. And those include hypertension, diabetes, the cancers, although some cancers have an infectious origin, but generally you can classify diseases in those two categories. And so those are the kinds of things we look at. We look at both infectious and non-infectious diseases. And our role is pretty much to conduct research in all those areas. So I initially talked about HIV, TB, malaria, because those are the commonest diseases we are facing. But you remember recently we even had COVID.
Yes.
So we were one of the institutions that was at the forefront of combating that disease when it came. I'm sure some of you got treated or tested at TDRC, as it was known as, and then. But we also have emerging diseases that are coming up nowadays. We have reports of monkeypox, for example. So we save our mandate, our expanded mandate also serves as we serve as a place for as a diagnostic center. So we have one of the well-resourced, internationally recognized laboratories in the country. So we do receive samples from across the Copper Belt, Northwest, and Wapula, bringing samples for certain diagnoses at TDRC or NHRTI. So we serve not only as a research center, but also as a national reference laboratory for research and diagnostics. So in that way, we are contributing to the response. When the government is trying to fight a disease, we do contribute in our own way, quietly. When you are receiving results, the ministry is giving results about an outbreak somewhere or a disease, we would most likely would have, our scientists would have been involved in the process of producing those results.
All right. Maybe before we go to with our question, we can break for a minute for a break. We'll be coming right back. Zanis Copper Belt Province brings to you The Lens, a program designed to bring insightful information on economics, mining, education, health, tourism, agriculture, environmental issues, sports, entertainment, current affairs, and many issues affecting the well-being of society. Right, welcome back. We continue with our program. Doc, what progress has been made in malaria research, or what is the progress in the research on malaria?
So our research focus at the NHRTI at the moment has been looking at different things in malaria. We have doing some clinical trials where we are testing or investigating, conducting studies on new drugs, new molecules. So in Chongwe right now we are conducting work on a rectal artesunate. So it's similar to the drug that we are currently using for malaria, which is Coartem, but how to use that in children through the rectal route. So that's one of the studies we are conducting. But we're also conducting studies in insecticides. So we are always testing new insecticides. These are chemicals that we use for controlling mosquitoes that either we use for indoor residual spraying, or later on maybe we can use them also on the nets, the bed nets. So we are conducting studies on that. We're also conducting studies on severe malaria and how to treat severe malaria, or how to treat anemia resulting from severe malaria. So those are the current studies that are going on, and in various parts of the country. And so our work has always been informed by the needs of the country. So if malaria continues to kill thousands of Zambians every year, we had more than 9 million cases recorded by the National Malaria Control Program in just 2024 alone. And so it still constitutes a very serious burden on the health of the population. And our work is trying to find different ways of controlling the disease.
All right. There were some Zambians who claimed that they have discovered the HIV cure. I'm talking about the sondage and the Malicin formula. Did your institution follow up to verify these claims, and what was your finding?
Okay, so it's a very interesting story, because let me start with the sondage formula. So the sondage formula was actually tested by our institution more than 10 years ago. We conducted the first phase. Or, there are several phases or steps in testing a new drug, such as the sondage formula. What we call phases. So there's phase 1, phase 2, up to phase 4 when we are testing a new drug. And so TDRC, as it was then called, or in HRTI, conducted a phase 1 trial right here in Ndola for the sondage formula. And now the phase 1 trial involves just looking at the safety of the product, or the safety of the chemical. Because, the owners, whoever owns a traditional drug, they will make many claims. They will claim this cures all sorts of diseases. And the first task for a research team such as ours is to make sure that that product meets certain safety standards. So we conducted the research in partnership with the owner of the product, where we established the safety of the product. And then the next stage is supposed to be a study where we now look at the efficacy to see how well it works against the disease that it is claimed to cure. And so what we did was a safety trial. We are yet to conduct the efficacy trial, and that it will be called phase 2 and phase 3. And the reason we haven't done that is mostly due to not enough funding being available for us to do it. But we are available. We'll be making efforts as an institution to find the money so that we can conduct the rest of the studies required for us to establish once and for all the efficacy of this drug. We realize that this drug has been in use out there in the community, but it is what you can call a traditional medicine. And traditional medicines are like the other one you mentioned, myglycine. Again, we are aware of it. We are aware of what we can call claims about what it can cure, because people would say it can cure COVID, it can cure HIV, it can cure malaria. So our job will be to work with the owner of that product to establish, one, its safety, two, its efficacy, and then document all those things and then move forward. So with the research mandate that we've received from government, that will be our role. Our role will be to work with whoever comes up with these indigenous products, to document them, to test them for safety, for efficacy, and then for posterity out there. Because as people, as you know, the indigenous knowledge that we have, most of it is not written down. It sits in the culture, the norms of the people, and you realize a lot of people will know about, if someone has a headache, they will head into the bush and come up with a herb and say, take this, and they'll get better. But so our job that we've now been given as of December 2024 is to get that information, document it, standardize those drugs after we do our tests, so that we make it available to a wider range of the population. So because even some of these Western medicines that we use, actually some of them have origins similar to what we call traditional medicines now. Some of them started out as traditional medicines, and then they were tested and then mass produced. So what we want to do as an institution is to get into that space and work with the indigenous population, the traditional medicine people, get those products, test them, because sometimes you might think that something might be curing something, but some of them may also have certain impurities that might be harmful to the population. So we will be working with people to look at those claims, test those drugs, both for the intended purpose, but also look at what else within those chemicals can be harmful, so that we can separate those from the product.
All right. Yeah. Just on the sondage formula, it has been many years now. I think when I was even still young, and I remember during the late Lev Mwanawasa, they wanted to test it and so on. I think, I don't know if it could be the third time that maybe your institution was involved. They wanted to test it, and it just died a natural death. And that medicine, as you said, it is still in the public domain. People are using it. And as a nation, no one has come to ensure that the efficacy of that medicine is studied, but we have money to buy already made ARVs from outside. We can't embrace our own. has taken so long? Is it, what could be the problem? There must be a problem somewhere.
Yeah. The problem is to find the funding for, normally the testing of drugs is done by the developer. Okay, so those ARVs, and malaria drugs and whatever medicine we are testing, they usually funded, the testing of those is funded usually by the promoter or the manufacturer. So it's easy for them to say, oh, I have this product, I think it can work, here's the money, test it for us. And then we test it. But where the product is coming from an ordinary citizen, it's very difficult for them to find the money themselves for testing. Then it means then we have to find it elsewhere. So it's not as straightforward as we have this product A, then we just test it, because it involves quite a bit of money for us to establish the safety. A lot of laboratory work is involved, which is not cheap. A lot of, you need to recruit hundreds, sometimes thousands of people, give them a drug, and then test them and follow them up and see if they are going to get better. So it requires money. And so, it's not as easy as it sounds to find the funding for it, but we are ready to partner with any institutions and collaborators that can help us to unlock this and be able to do the testing that is required.
All right. And with the freezing of the funding on HIV/AIDS and USAID, what are your plans in embracing the sondage formula as well, which was even tested, actually, even South Africa tested it, and there was even time when they wanted to buy it from him, but he refused.
Well,
and the results actually from people who have used the others even claim that it's more effective than ARVs, and but as a country we have failed to embrace it up to now. Yet it's our own discovery. What can we do to ensure that we don't lose this opportunity to have our own medicine that can cure HIV/AIDS?
Okay, so your question is loaded. It has HIV and sondage formula, but also USAID. So let me start from the funding from the USAID. We have not been affected that much as an institution from the withdrawal of funding, mostly because we have a lot of other sources of funding, including GRZ, by the way. So we get quite a lot of money from the government, but we also have other partners that we work with, that we collaborate with to conduct our research. But when it comes to the sondage formula, like I said earlier, we are ready to conduct the rest of the testing that is required. Like I said, phase 2, phase 3 studies for us to know how effective it is or efficacious it is. People out there are using it. I cannot speak to how effective, because how efficacious it is out there, because those are anecdotal stories. We rely on things that we've proven. And as long as we haven't proven, I cannot speak to it. But we are always ready to work with the promoters of the sondage formula to complete the work that we started and do the testing.
All right. Well, viewers, if you have just joined us, this is Your Lens, and on today's program we are discussing about the National Health Research and Training Institute, which is formerly known as the Tropical Diseases Research Center. And with me in the studio, I have Dr. Gershom Chongwe, who is the Director General. We continue, Doc, with our questions. What is the procedure one should follow to have their herbal or traditional medicine certified?
Okay, so our role is to, when someone has a traditional medicine, is to do a few things, starting with establishing how safe that traditional medicine is for the human body. So we conduct tests. Of course, some of the tests are done on animals and then on people. And once we establish it's safe, that's when we start looking at whether that drug or chemical or herb is efficacious. It can work against the disease that they claim it is meant for. So when it comes to traditional medicines, which actually don't even follow the full, what I would call standard protocols from phase 1 to phase 4, there are certain criteria that we follow from WHO that sort of truncates the process and makes it shorter and probably cheaper, so that it becomes easier for us to bring that traditional medicine to market faster than when it is an ordinary or Western chemical. So there are certain procedures that we follow, beginning with the safety, and then both in animals and in a small group of people, then followed by efficacy that we follow, that are available to us, that when someone comes with a traditional medicine, they simply should come to our offices. We are based here in Ndola, on the 60th floor of Ndola Teaching Hospital. That's where our offices are, and our labs, of course, are also on the same, in the same building on the 7th floor. So they should approach us. Then we will work together to establish the efficacy of their drug.
All right. Does also your institution have intentions to research on traditional medicine or remedies?
Traditional medicine for?
The intention to conduct some research on traditional medicine or remedies.
Yes.
To certain diseases.
So yes, we have just received that mandate from the government, and so we are ready, and we have the capacity. We're just working on in the process of establishing a unit within our institution that will be specifically working on that expanded mandate to look at traditional medicines. Yeah.
Or do you even receive some requests from people that may be coming up with their traditional medicine, then they approach you? Do you receive such requests?
We do, and we are currently working with, let me say, 2 traditional people that have approached us with claims that their herb is capable of treating or curing diseases such as COVID and HIV. So as per our mandate, we are working with them to establish the veracity of those claims by testing their drug, beginning with the simple things, but those things that require a lot of money, then we'll work with them to find the money and then do more complicated testing later.
Doc, apart from the services that you offer in researches, what other programs do you offer?
Yeah. So apart from the health research that we conduct, we have a clinic on the 60th floor of Ndola Teaching Hospital that is available and open to the public. So we offer services, outpatient services. We also have specialist services such as a gynae clinic, adult medical clinic. We will also be soon introducing X-ray services. We have ultrasound, we have ECG. So you can come to our clinic and get services from our doctors because as a research institute, we have staff from various areas in the health sector. So we have nurses, doctors, lab scientists. So apart from having those staff conducting health research, they are also available to see patients. So you can come to our clinic on the 60th floor. Apart from that, we serve as a center for training. So we host a lot of research scientists. Any scientist that wants to do research can come and work with us, use our facilities. We agree on how they will use our facilities for them. For example, someone is doing their master's, they're doing their PhD, they are free to come and we can talk on how they are going to use our facilities for them to complete their studies. But apart from those are at a higher level, we also have even just students who get attachments at our institute as part of their training. Because of our labs being internationally accredited, students who wish to get exposed to a high-level laboratory in the country can get attached to our institute as part of their training. So those are some of the other services that we offer to the public. So we are also available for any institution to hire us to conduct research on their behalf. So that's a part of our consultancy work. So we can be hired as a consultancy to conduct research on behalf of another institution. So those are some of the work we provide. Is the clinic
also NEMA accredited?
Yes, the clinic is accredited by NEMA. It has been from inception. And you are free to come with your NEMA details and we will attend to you. We also have medical schemes with companies that are interested, can establish a medical scheme and get services from our clinic.
All right.
Thank you.
All right. As we conclude, going forward, what should the nation expect from your institution?
So our institution has a reputation for conducting high quality research that spans decades. We've been in this business of health research for 50 years. And so the public should expect more of that. But so we want to be a center of excellence in health research. Not only that, we want to be the place where people go to learn on how to conduct research. So capacity building is something that is something that we are expected to also provide, and we will be providing. Apart from that, we also are designated as a national health reference laboratory. Now that means that our lab is a reference laboratory for health research. We have certain standards and benchmarks that we will have, and we have established, that people can, who are running similar labs, can come and learn from. So through that, we'll also be providing training. Beyond that, the public should also expect our institute to be a place where they can come and do their own research. So our institute has been called upon to establish a national research data repository. Now, that means that we will be maintaining a repository of any health research that we've done. For example, if we've done research in sleeping sickness, or research in bilharzia, or research in HIV, all those research projects and the data involved will be kept in a repository, so that the public can come and say, if you, even a journalist or member of the public, wants to say, okay, what do we know about this subject? How much research and how much information do we have on this disease in Zambia? They can come and search our database and be informed about what we know about that research subject. That is extremely important, because it helps, of course, to document very important information for our country, but also prevents us from doing the same research over and over again. If someone has done research, we keep it in a repository. Another person shouldn't repeat the work that has already been done. That is unethical. That would be a waste of resources. They can come and search our repository and learn from it, and then maybe make up decisions on what kind of other research questions they can answer based on the available information. So again, that is a new mandate that we've been given, and they're just working on establishing that research data repository.
All right. Well, viewers, we have come to the end of our interview, and we are looking at the National Health Research and Training Institute, which is formerly known as the Tropical Diseases Research Center. And in the studio, I have Dr. Gershom Chongwe, who is the Director General. Well, this is where we end, Doc, and we are thankful for making an appearance on the lens.
Thank you very much. Thank you for inviting me.
All right. On behalf of the technical team, see you next time on the lens. Bye-bye.